Hello everyone, so I am back with a new video that is of the very most common condition through which our grandparents suffers the most. So let's tackle with it the osteoarthritis. We will have a discussion on definition of osteoarthritis, types, then pathology, that is how the disease progresses, then the clinical features, next examination, how we will examine the patient of osteoarthritis coming to our OPDs, then what are the various investigation we have to do to get the confirmed diagnosis of osteoarthritis, and then lastly the treatment. So myself Shweta Anande and I am studying in third year BHMS. If you haven't subscribed to my channel, please do so and hit that like button. Also press that bell icon to get first notification of my videos to you. So let's get into the video. First of all, what is osteoarthritis? Osteoarthritis is a degenerative joint disease. The etiology of it is a multifactorial and still not understood. That means the multiple factors are there which results in osteoarthritis. Commonly, it is thought to be wear and tear of a joint as one ages. Due to increase in age, there is wear and tear of joint, and that is what to be thought that the reason of osteoarthritis. So this is the normal joint which is showing its free movement without any tension or pain in it. As it is a degenerative joint disease, let us first understand the normal structure of a joint. Basically, the joints are of three types, that is immovable joint which do not move or which do not allow any movement. Secondly, the slightly movable joints which allow some restricted movements, and third, freely movable or also called as synovial joints which allows the free movement. This is the picture of typical synovial joint in which the bones which are forming the joints are covered by a articular cartilage. To lessen the friction and smooth movement, then the joint capsule which surrounds both the bones which are forming the joints. There is a synovial membrane which lines inside the joint capsule, and it secretes one fluid called as synovial fluid which acts as a nourishment to the cartilage and absorb the shock and trauma. Lastly, the ligaments which provides the extra support to a joint. So this is the full picture of an ideal synovial joint. So now anything that causes the inflammation of a joint is arthritis, and osteoarthritis is a degenerative disease which occurs due to degeneration, that is wear and tear of a joint as the age increases. So there are two types of osteoarthritis, primary and secondary. We will see one by one. Firstly, the primary osteoarthritis. It occurs in a joint de novo, means a joint is affected by osteoarthritis but it does not have any pre-existing condition or a reason. Firstly, first time. So here it occurs in old age, mainly in the weight bearing joint, that is knee and hip joint. In a generalized variety, the trapeziometacarpal joint of the thumb and the distal interphalangeal joint of the fingers are also affected. So this is the distal interphalangeal joint which is affected, we can see. Then primary osteoarthritis is a commoner than the secondary osteoarthritis. So this is occur in a de novo, in the old age, and mostly involves the small joints like interphalangeal joint. So here in secondary osteoarthritis, there is an underlying primary disease of the joint which lead to the degeneration of the joint often many years later. It may occur at any age after adolescence and occurs commonly at the hip joint. In secondary osteoarthritis, there is underlying primary disease of the bone such as osteomyelitis or the any condition which weakens the bone already, and so that the osteoarthritis occurs, and it is called as secondary osteoarthritis. So what are those pre-existing conditions we are saying underlying primary disease? So these are the various predisposing factors which cause the secondary osteoarthritis. That is, first, congenital maldevelopment of a joint, that is the joint is not properly developed since birth. Second, there is irregularity of the joint surfaces from the previous trauma, that is there may be any previous accident due to which the affected bone surfaces have been irregular and now they are producing pain. Then third, previous disease producing damaged articular surface, like the articular cartilage itself is not well developed. Then internal derangement of the knee, such as loose body. Then malalignment, that is bow legs and etc. shown in the picture. This is the malalignment of the leg, bow leg. And lastly, the obesity and excessive weight. Obesity is one of the leading factors to happen the osteoarthritis. So these are the various predisposing factors which leads to the secondary osteoarthritis. In primary osteoarthritis, there is no any charge as it is a de novo condition. So this is how the predisposing factors for secondary osteoarthritis. Then pathology. Osteoarthritis is a degenerative condition primarily affecting the articular cartilage. What is articular cartilage? We have seen in this diagram, that is the articular cartilage is the cartilage which surrounds the bone which is participating in formation of a joint. So in osteoarthritis, the degeneration of the articular cartilage occurs. So firstly, we will see what is the cartilage composed of. As here the main role is of articular cartilage, let us understand how the articular cartilage is made up of so that we can understand its degeneration. Firstly, we have seen the normal joint structure. So now we will discuss about the normal cartilage. So basically the cartilage is made up of cells plus fibers plus ground substance. So cells which are present are the chondrocytes, then fibers are type 2 collagen, and ground substance of the cartilage is proteoglycans. All these three combinedly makes the matrix of the cartilage. So anything which disturbs one of them will have effect on the strength of the cartilage. This is but obvious thing, that is anything which disturbs one of them which will affect the strength of the cartilage. So what happens in osteoarthritis? The first change that is observed is increase in water content and depletion of the proteoglycans from the cartilage matrix. So decrease in it will eventually make the cartilage weak and losses its strength, causes the degeneration of the cartilage. Secondly, the chondrocytes production is maintained by two enzymes, that are destructive enzyme and constructive enzyme. So by their names they are suggesting their functions, that is destructive enzyme will destruct the chondrocytes and constructive enzymes will construct the chondrocytes. So increase in destructive enzyme will decrease the number of chondrocytes, and ultimately decrease in number of the chondrocytes will affect the strength of the cartilage. So it will ultimately lower the strength of the cartilage and results in degeneration. Repeated weight bearing on such cartilage leads to its fibrillation. It is but obvious that as the cartilage is getting weak due to above reason, that is decrease in osteophytes, decrease in proteoglycans and decrease in chondrocytes, will make the cartilage weak, and on this weak cartilage the repeated weight bearing will leads to fibrillation. The cartilage gets abraded by grinding mechanism at work at the point of contact between the opposing articular surfaces until eventually the underlying bone is exposed. So after so much of grinding, the cartilage will totally get abraded. Abraded means erosion of the cartilage will occur and the underlying bone will get exposed. And still the rubbing continues, the bone will become hard and glossy, and such part of the bone is called as abraded bone. So further rubbing will of the subchondral bone becomes hard and glossy. Subchondral bone means under the cartilage, the bone which is present under the cartilage is called as subchondral bone. So here you can see in this picture also, here there is a layer of cartilage which attached to the bone, and here the cartilage is eroded, that is abraded, and the underlying bony part is exposed, which is hard and glossy and is called as hibernation of the bone, that is hibernated bone. Meanwhile, the bone at the margins of the joint hypertrophies to form the rim of a projecting spurs known as osteophytes. As it is our body's tendency to cope up with the loss. So here there is the loss of a cartilage. To cope up with it, the bone margin hypertrophies to form the rim, and its projecting spurs are known as osteophytes. These are some osteophytes. This is the loss of the cartilage which is exposing the bone, and this is bony rim of a bone which is being hypertrophied, and there is the formation of bone spurs. The loose flaps of the cartilage inside the synovial membrane and thickening of the capsule leading to deformity and stiffness of the joint, and this projecting spurs inside the synovial cavity and inflammation starts, which cause the deformity and stiffness in the joint with much more pain. Often one compartment of a joint is affected more than the other. For example, in a knee joint, the medial compartment is affected more than the lateral, leading to the varus deformity, that is genu varum. So varus deformity, what is varus deformity? Varus means it involves the oblique displacement of a part of a limb towards the midline. This is the oblique displacement of a part of a limb towards the midline. This is called as varus deformity. So sometimes what happens, the only one compartment of a joint is affected rather than the other. So this condition is called as varus deformity. So this is how the pathology of the osteoarthritis. So we will have a quick review on a pathology. So what happens first, there is a decrease in proteoglycans. What are the proteoglycans? Proteoglycans are the ground substance of the cartilage. So decrease in proteoglycans because of increase in water will hamper the strength of the cartilage, which eventually make the cartilage weak, and the strength of the cartilage gets decreased. Then second, decrease in chondrocytes. Why the chondrocytes get decreased? Because chondrocytes are maintained by two enzymes, destructive and constructive enzyme. So increase in destructive enzymes will cause decrease in chondrocytes number, and this will ultimately lowers the strength of the cartilage. So because of these two reasons, the cartilage gets very weak, and on such cartilage, repeated bearing on affected part, that is cartilage, will result in fibrillation, and cartilage gets abraded, that is erosion of the cartilage occurs, and there is exposure of subchondral bone, that is bone under the cartilage. Due to the rubbing of the bone, as there is no cartilage left or on that part, the bone becomes hard and glossy, that is called as hibernation of the bone. Then the bone margin gets hypertrophy to cope up with this loss. So there are the formation of osteophytes, and these osteophytes are the spurs, and the spurs inside the synovial membrane, which initiates the inflammation, then stiffness, deformity and pain. So this is how the pathology progresses. Firstly, there is decrease in the strength of the cartilage. On this decreased or weak cartilage, there is repeated bearing, which leads to fibrillation. Then fibrillation causes the erosion of the cartilage, that is abrasion of the cartilage. Then there is bone exposure, and again the rubbing on this, the bone margins become hypertrophied and causes the and there is production of osteophytes. These osteophytes inside the synovial membrane, this causes the inflammatory reaction, that is deformity, stiffness and pain. So this is how the pathology of the osteoarthritis. Next, we will see the clinical features of the osteoarthritis. What will be the clinical feature or the signs or symptoms to the patient? The disease occurs in the elderly people, as we are seeing, as the one's age there is wear and tear of the joints, so it will be seen in the elderly people, mostly in the major joints of the lower limb. The hip joint is commonly affected in a population with western living habits. There is some clinical feature depending upon the habits of the people. So it will the population which is affected in the hip joint is the western living habits, and the population which is affecting the knee joint are involved most commonly a population of Asian living habits, that is the habits of squatting, sitting, cross-legged. Okay, so pain is the earliest symptoms. Then a coarse crepitus may be complained by some patients. What is crepitus? Crepitus is the sound from the joint while movement of that particular joint. So this is the crepitus. Then swelling of the joint is usually late feature and stiffness is also a late feature. So why swelling and stiffness is a late feature? Just now we have seen in the pathology flow chart that when the stiffness comes at last, when the spurs which are formed by the hypertrophied bone margin will inside the sinual membrane, then the stiffness and deformity and pain occurs. So it is the last event in the pathology. That's why in clinical features the swelling of the joint and stiffness will occur lately. Okay, then other symptoms are a feeling of instability of the joint and locking resulting from loose bodies and frayed meniscus. Okay, then what are the examinations we will do on a patient? So firstly we will see tenderness on the joint line, crepitus, that is sound from the joint while its movement, then irregular and enlarged looking joint due to formation of peripheral osteophytes, then deformity, varus of the knees, then flexion adduction external rotation of the hip, whereas we have seen the oblique displacement of a part of a limb towards the midline. This is the varus of the knee. Then effusion, it is rare and transient. Then terminal limitation of the joint movement, there are some limitation in the movement if the osteoarthritis is there. Then we will see for subluxation detected on ligament textin. Sometimes the tenderness pain will be there due to subluxation, so we will see. Then wasting of quadriceps femoris muscles, so this will all the things which we will examine in a patient. Then what are the investigations, what we will have to rule out is, firstly we will do the x-ray, that is radiological examination. The following are some radiological features. So what we will see in the x-ray, if the patient have the osteoarthritis, this is the normal x-ray and this is the x-ray of patient having the osteoarthritis. Okay, so firstly what we will see is narrowing of joint space, because there is loss of articular cartilage. Here the articular cartilage is present, that's why we are able to see the space between the two bones, and here the space is narrowed down. There is no space between the two bones because there is the loss of the articular cartilage. So often limited to a part of the joint, example may be limited to the medial compartment, that is tibiofemoral joint of the note, that is nothing but the varus deformity. One compartment of the joint is involved, other is not involved. Here we cannot see any space, that is this part is affected by the osteoarthritis. Here the space is present, that is here the cartilage is okay. Then subchondral sclerosis, that is dense bone under the articular surface. There sometimes we can see the subchondral cyst. Then osteophyte formation, here we can see the osteophyte formation in this x-ray of the patient having osteoarthritis. Then loose body and deformity of the joint, yes, lastly the joint will be deformed. Then what are the other investigations which are made primarily to detect an underlying cause? So we have to detect, or we have to know the stage of the disease, that is whether it is the primary osteoarthritis or secondary osteoarthritis. As in primary osteoarthritis there is no any underlying cause, it is a de novo, and in secondary osteoarthritis we have seen that there are some underlying cause which are the predisposing factors. So we have to do other investigation to rule out the stage of the disease, whether primary or secondary. So we will do some serological tests, that is ESR, to rule out rheumatoid arthritis, is there autoimmune cause, that is rheumatoid arthritis. Then the serum uric acid level to rule out gout, whether the patient is having gout or not. Then arthroscopy if a loose body or frayed meniscus is suspected. Okay, so these are the other investigation to rule out the underlying cause. Then treatment part. So the patient has detected for osteoarthritis, then if it is primary, then what will be the mode of treatment, and if it is secondary, then what will be the mode of treatment. So firstly the primary treatment is to delay the occurrence of disease if the disease has not been begun yet. Of course we will have to aware the patient about this. Then second, to stall process of the disease and relieve symptoms if the disease is in the early stages. If the disease is of primary nature, then we have to palliate the disease disease by giving the analgesic to reduce its pain and to treat the early symptoms of the disease. Then to rehabilitate the patient with or without surgery if his disabilities can be partially or completely elevated. If the cause of the primary osteoarthritis is due to because of the obesity, so we can advise the patient to decrease his or her weight to complete or partially elevate the disease. Okay, so this is the primary way to treat. And then secondary, then drugs like analgesic to reduce the pain, then chondroprotective agents like the second cause of the disease we have seen is decrease in chondrocytes. So we will give in treatment that the chondroprotective agent, that because of which the chondrocytes will be protected, that are glucosamine and chondroitin sulfate. These are the two agents which will protect the chondrocytes and will prevent the decrease in chondrocyte number, which will not get into the further steps. So then viscous supplementation, that is sodium hyaluronate, which is the substance which keeps or maintains the level of the synovial fluid in the joints, which will eventually make the free movement, will provide the function of the lubrication. So which we will give the viscous supplementation to maintain the synovial fluid. Then supportive therapy like weight reduction, advanced avoidance of stress and strain to the affected joint, local heat and exercises. Then lastly, the surgical treatment involves the osteotomy, joint replacement, joint debridement and arthroscopic procedure. So this is all about the topic osteoarthritis, which commonly affects the elderly people. Hope you have got all of the it. So thank you.